Thank you, Mr. Speaker. To the bill.
To the bill.
I'm here to urge a no vote on Senate Bill 1089, a bill that would establish Universal Health Plan Governance Board tasked to create a state-run, single-payer health program for all of Oregon. The Joint Task Force on Universal Health Care recently concluded that a single-payer plan would cost Oregon taxpayers an additional $20 billion per year. As a point of reference, I believe the governor's 23-25 budget estimated $11.7 billion in annual personal and corporate income tax revenue. In other words, going to a single-payer program would increase taxes by 270%, almost triple. Who pays for this burden hasn't been determined yet, but undoubtedly much of it would fall on the middle class, high-income earners, and small businesses. A recent study by Ernst & Young, commissioned by Oregon Business and Industry, notes that the Oregon business tax burden has increased 45% since 2019. In Portland, the burden on business is even higher, and it isn't just businesses feeling the hit. Portland now has the nation's second highest combined state and local individual income tax rate. At 14.69%, Portland's combined rate trails only New York at 14.78%. I do not believe that such high tax rates are in the best interest of this state, and based on the businesses and income earners and the exodus from Portland, I think many people agree. So given our current excessive personal and business income tax rates, does it make sense to triple them? I don't think so. This $20 billion cost estimate also assumes efficiency gains through the healthcare delivery system. I am highly skeptical that putting the state and the Oregon Health Authority in charge of all healthcare will increase efficiency. The agency is not the model of efficiency, to say the least. The bulk of the administrative costs in our healthcare providers are from state and federal mandates, reports, and audits. They are not coming from the private side, but rather the public side. My own personal experience in business validates this. I have personal experience with thousands of project contracts, each with its own terms and conditions, requirements, etc. The most challenging and the most costly contracts were the ones with state and federal entities. They required more paperwork, more reporting, more auditing, more overhead. Given an identical scope of work, a public project was always more expensive than a private contract. So, excuse me if I'm skeptical when someone says, I'm from the government and I'm here to streamline your operation, make you more efficient, and save you money. We heard about these challenges in many healthcare committee hearings, how the state required unnecessary paperwork, burdensome and useless audits, and extensive detailed reports that gathered cobwebs somewhere were never used. Add to this the other problems we heard about every day, that the state's healthcare wages and reimbursement rates are not keeping up with market conditions. State action and inaction is the reason for much of the problems we see today in our healthcare system. A shortage of nurses and other care providers, stressful and overworked staff, and burnout. These conditions are in large part due to state control. Adding to that control can make things even worse. I'm also concerned that if we hand our entire healthcare system over to the state, what is next? We already see a huge push to ensure what are so-called social determinants of health. Oregon, with the Medicaid 115 waiver, is taking the national lead on making sure our public plans cover such social determinants. This means Medicaid dollars will be used for air conditioners and housing, both considered as social determinants of health. But it doesn't stop there. The CDC and the World Health Organization define social determinants of health as the non-medical factors that influence health outcomes. They are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. These forces and systems include economic policies and systems, development agendas, social norms, social policies, racism, climate change, and political systems, end quote. That is what social determinants of health are. Based on this definition, what in our lives is not considered a social determinant of health? And in turn, what in our lives would not be considered health care? If we hand the state total control over our health care using the social determinant model we're now adopting, what else in our lives do they want to take over? I think you can see where this is headed. By no means am I saying our current system is perfect. There are many areas for improvement, but handing control over to the government will just create new problems. A recent paper in the Journal of American Medical Association, JAMA, covered some of these issues. By some reports, government-run programs create their own myriad of regulations and administrative burdens. They may prevent some individuals from obtaining the coverage or receiving the care they desire. Government programs may limit choice and fail to incentivize efficiency or patient-centeredness. And government-managed cost containment, e.g. price setting, runs the risk of adversely affecting access or quality of care. We see many of these problems already with the state and the Oregon Health Authority. Let's not make it worse. Vote no on Senate Bill 1089. Thank you.